Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale-Paradise Valley area since 1992. I perform a lot of body contouring surgery, and that includes tummy tucks or abdominoplasties. A very common question that I get from patients, that are thinking about having a tummy tuck or some combination of procedures are, Dr. Shapiro, are tummy tucks permanent? And if I have a tummy tuck and it is permanent, and there's something I don't like, what are the options for touch-up? So the answer to the question is a couple. The first thing is that tummy tuck is an operation where I remove excess skin and remove some fat from the abdominal wall. I most often will tighten up the muscles of the abdominal wall to give a flatter, more contoured abdomen. I like to sutures to improve the waist dimension. I most often will take that excess skin, leave your belly button where it is, and then bring it out through some new skin. And I like that incision incredibly low. I go through a whole process when I do a tummy tuck. I have you bring in some underwear or a bathing suit the day of surgery. I mark that incision very, very low so it is inconspicuous. In my practice, I have very, very few revisions. I do a technique that enables me to remove some excess tissue above the belly button. Hence, I don't need to do liposuction in that area. Many surgeons will not perform liposuction or reduce tissue above the umbilicus in that they are fearful that it will disrupt the blood supply. That is not the case in my practice. I perform a procedure that is very much popularized in Brazil, where I actually remove fat at the time of surgery below a plane that does not jeopardize the blood supply. Also, I take painstaking efforts to remove any extra tissue laterally, hence I don't end up with those dog ears that people talk about. And what that is excess tissue along the lateral aspect of the incisions that has to be liposuctioned at a later date. The reason why that happens is people try to minimize the length of the incision, of course, and that oftentimes will leave some excess tissue laterally. In my practice, I perform the liposuction that I need to do laterally at the time of the operation. Hence, the number of revisions that I have to do are very, very minimal. I say that the revisions are going to be more common in people that are ethnic, whether it be a darkened scar or some scar irregularity, whether it be Latino, Asian. Those are the most common people that have some issues with the scars. But there are many things that we do post-operatively, whether it be laser or silicone gel sheeting or scar creams. All in all, you find that there are very few revisions in my practice. Yes, the answer to the question for a tummy tuck is it is a permanent procedure. If you put on more weight, you'll put it on really generally in the whole area in my practice. In other patients that I see from other doctors, oftentimes that excess tissue that is left above the belly button lends itself to gathering more fat if you put on weight, and it looks disproportionate. So as long as you stay within a body weight of around 15 pounds or so at the time of surgery, I think you'll do great. I think you'll love the tummy tuck. I think it's a long-lasting result that makes you feel younger. It makes you look better in clothes. In my practice, I put the scar very low so you look good in the bathing suit. I'm totally neurotic about my belly button, so all in all, I think it's a win-win for you. I think the best way to find out if you're a candidate for a tummy tuck is to read about it, come in for a consultation, look on my website, see my before and afters, show me some pictures of what you would like to end up with, and we go from there. Thank you.